All right. I think we can start now. Greetings, everyone. Welcome to our sixth session or like webinar hosted by the AFRONE. We are glad to have you all on board and we're looking forward to make this a fruitful session. Before we begin today, as usual, we have a few guidelines to make the most of the meeting. First of all, the microphones and cameras will be turned off to minimize the distractions and ensure optimal quality. So if you're having any questions, your active participation through the chat function is highly encouraged. Please leave the questions in the chat and we will monitor and respond to as many as we can after the session. Just know that the session will run for 1 hour. The first 45 minutes will be the main presentation and followed by 15 minutes for the Q&A session. And please know that the session will be recorded for future reference and knowledge sharing purposes. It will be later made available on our LinkedIn, on the WhatsApp group, on our YouTube, by the way, and on the AFRON website as well. Lastly, your feedback is invaluable to us, so please, I will share a feedback form in the webinar here, in the chat and on the WhatsApp group as well. Please take a few moments to share your thoughts with us and fill in the form. Thanks a lot. Now, please join me in welcoming today's speaker, Dr. Omolola. She's a lecturer and specialist in public health dentistry. She obtained her Bachelor of Dental Surgery degree from the University of Ibadan, Master's in International Public Health from the University of Sydney, Australia, and Fellowship from the West African College of Surgeon. She is also a PhD candidate in Global Health at McMaster University. Dr. Lola, please go ahead.
Hi, thank you for your warm welcome, and thank you everyone for joining me this afternoon for this 1 hour. I truly hope that it will be rewarding for all of us. It will be mutually rewarding. So if I may ask, if you could just let me know when I'm at the 30-minute mark so that I know I have 15 minutes to go, just so I leave enough time for questions. Okay, thank you. So today we're going to be looking at designing qualitative oral health research studies. And just as a sort of background, before we dive into the topic, this is a search. This is a screenshot of a search that I ran on PubMed. This was almost 2 years ago in 2022. So it was a very quick and dirty search, oral health and qualitative, to sort of get a picture, an idea of where we are in dentistry with qualitative research. And I'm sure you'll agree with me looking at this screen that since the 1970s, it's been on the upward trajectory. I'm pretty sure if I updated this now, it would still show an upward trend. So more and more people in the health sciences, in biomedical research, are keen into qualitative research. It used to be the domain of the social scientists and people in the humanities, but I guess we're all sort of more realizing that context matters when we are dealing with health behavior, planning interventions, and dealing with diseases of all sorts. So as we go on, I'm sure you'll agree with me why we as dentists need to empower ourselves and be equipped for this very important research approach. So I intend that at the end of the 45 minutes that I'll speak for, that we'll be able to identify research paradigms and maybe reflect on which paradigm is appropriate for qualitative research, would also be able to list the elements of a qualitative research question. So in writing a qualitative research question for oral health, would be able to reflect on what are those elements, what verbs should we use, what should be the aim, what should be the objective. And then we'll run very quickly through qualitative research study designs, and then round up by listing methods and analytical techniques. I'm sure you'll agree with me that this is a tall order, so it will be really a very high level overview. There's no way to cover qualitative research in a 1-hour session. It's not possible, but it'll be a very high level overview that I'm sure that we'll all be able to go back and dive into deeper and build upon. So research paradigms. So very broadly speaking, there are 3 approaches to research. There's the quantitative, the qualitative, and the mixed methods approach to research. And all of these approaches, each of these approaches builds on a paradigm, a way of thinking, like a worldview or philosophy. So I've given 3 paradigms here: the post-positive paradigm, the constructivist paradigm, and the pragmatic paradigms. These are not by any means the only paradigms, but these are the most common and the ones that I have chosen to speak to just help us have an idea and an overview of the idea of paradigms in research. So quantitative research is built on the post-positive paradigm. So some people will say positive, post-positivism. And the idea of this paradigm is there's one reality, or there's one certain question, certain answer to a research question that you have, and you are doing your best to find that answer to the best possible precision. So for instance, maybe the distance between the Earth and the Sun, there's an answer. There's one certain answer, or the speed of light, or the speed of sound, or how many, maybe how many football players are on a field at a particular time. Those sort of questions lend themselves really well to the post-positive paradigm. The idea of there's one answer, is one reality. I'm just doing my best to find it with the greatest precision possible. And quantitative research has a lot to do with theory verification. So the idea of having a hypothesis and trying to accept it or fail to reject it, that's quantitative. But for qualitative research, it's one of the paradigms it's built upon is the constructivism. And this is the idea of multiple realities, the idea that people's perceptions and experiences are different, and the particular person I'm talking to may give me a different answer to my research question than if I was talking to somebody else or at a different time frame. So an example would be what dental caries means to different people. So for me as a dentist, dental caries may be a positive. When people have caries, then I have work to do, then I'm fulfilled, I have things to do. But for some other person, it's the idea of pain, and is associated with pain, or is associated with needing to find time to go to the dentist, or is associated with bad memories. So the idea of there being multiple realities, depending on what you're talking about. So for instance, maybe mathematics as a subject, to certain students, they love it, it's their favorite subject, and some students hate it. And all of these different perspectives and experiences are valid. So that's really the paradigm on which qualitative research is built upon, that recognition that context matters, experience matters, perception matters, and this really helps when we're trying to design interventions, for instance. So I won't speak to mixed methods because that's not what we're about today. So, but just the idea of as somebody who is seeking to develop a qualitative research for oral health studies, you need to be in that mind frame of thinking about different perceptions and different experiences, realizing that there could be many answers to the same question. So how do we write a qualitative research question? So we've seen the paradigm that we need to be in this paradigm where we're aware that there are multiple realities, there are many answers to the same question. But how do we write a qualitative research question, and what differentiates it from a quantitative research question? So this would be the idea of you're looking at depth. So for quantitative research, you want to be able to generalize your findings. You want to be able to say, I took some data from a sample, and because I took this data from a sample, I can speak to the entire population. That is not like the goal or the aim or the premise of qualitative research. The qualitative research is not about being able to generalize. It's just about diving deep, going in depth in that subject with the participant or the case study or the program that you're after. So it's about depth rather than breadth, and it's about meanings. So the aim is to describe experiences. And so the kind of experience with dental service utilization, explore people's experience with fluoride use, explore people's experience with maybe changing a diet from a high sugar refined diet to a more nutritious and balanced diet. So to explore, to understand, to describe, those are the kinds of verbs that should be used in constructing a qualitative research objective or qualitative research question. So explore, understand, describe. And so what are some study designs that are common in qualitative research? Like I said, we're not going to be able to go through everything, but these are some common ones. So I'll put an overview of research designs just by the approach. So for the quantitative approach, the qualitative approach, and then the mixed methods approach. So for the qualitative, narrative inquiry, phenomenology, grounded theory, ethnographies, case studies. Again, this is not an exhaustive list, but these are some of the very common designs that we see in qualitative research. So narrative inquiry, it's a story of the lives of individuals. So I have like a snippet from PubMed of a study that was done on an indigenous population, and it's about a pulp mill in their environment and the experience with contamination from the pulp mill. But what these authors chose to do was to do a narrative inquiry. So they spoke with 10 participants, 10 elders from that indigenous community, and had the elders talk about their lives. And then through their lives, so through the narration of their lives, the authors would extract, would bring out the things that are relevant to their research questions. So it's talking to people and getting them to talk about their life stories. Phenomenology. Phenomenology is also about a lived experience, but rather than focusing on the entirety of a person's life, phenomenology is about a particular thing that is of interest to the researcher. So like for this study that was published in 2019, it's about patients that undergone radiotherapy for oral cancer. So the phenomenon is treatment of oral cancer, a very specific treatment, which is radiotherapy. So this is in interviews with those patients, speaking with them, but getting them to speak specifically about that phenomenon. So about undergoing radiotherapy. How did they feel when they first heard they were going to have radiotherapy? What were the emotions? Who did they talk to? What support did they have? How was the experience of the radiotherapy? So talking specifically to that rather than an entire life story. So that would sort of differentiate phenomenology from the narrative inquiry, because it's the focus is on that phenomenon of interest. So I think I lost my screen. It's reconnecting.
We
I'll
cannot
just,
see them.
yeah, you can't see my screen. So I'll
No,
stop
no, we
share
can actually.
and then reshare and share. And so give me a second to
Take your time, it's fine.
yeah. Hopefully it's back on. Yeah.
Yes, all good.
Okay, thank you. So we've looked at narrative inquiry, phenomenology. Now we're on grounded theory. So grounded theory is very similar to phenomenology, except that the aim of the grounded theory approach is to build a framework, a conceptual framework. So it's still talking about a specific phenomenon of interest, but they're very specific like techniques and approaches to take that would eventually lead to the development of a framework. So this is an example here, exploring the role of the dental hygienists in reducing oral health disparities in Canada. So the phenomenon is about their work in reducing oral health disparities. But the idea would be to use the Cobbin and Strauss methodology. These were the people that developed the grounded theory approach and eventually have a framework from this. Okay, so then another one is ethnography. So this is a study of patterns of behavior, language, actions in an intact group in their natural setting. So it involves the researcher being the research instrument, being within the group and taking observations, interviews, writing memos and noticing things and describing things. So an ethnography could be, for instance, maybe I as a dentist wanting to know patient-dentist interaction in the dental clinic and going in. So I could go in overtly, like I let people know that I'm here, I'm conducting research, and I'm here to observe how you interact with your patients. So I could record the interactions if I have the permission to do so. I could take notes. I could have a checklist. I could, notice, take pictures, notice things about what is happening. So it could be overt. That is, the people concerned know that I'm a researcher and that I'm there carrying out this study and observing them. It could also be covert in the, like, I could go to a clinic and maybe I've arranged with the management to take up that I'm coming in for an appointment, maybe an observership or something, but in actual fact, I'm there for research. So depending on the ethical issues, the sensitivity of the setting, and what, if you can get ethics to scale through, it could be overt or it could be covert. Because a lot of people would say that there's something called the Hawthorne's effect. When people know that they're being observed, they change, like their interactions will change. So to prevent that, you may want to go covertly, but then it's also very dependent on ethical issues. So that's one study design. So this study is oral health self-medication in Colombia, and it's a qualitative ethnographic study. So that means that the researcher would have been in those communities and watching and observing. So maybe they're at the pharmacies and actively watching and observing how people take self-medicate for oral health. The next one I will speak to is a case study. That's also a type of qualitative research. It's particularly useful for evaluations. And so when maybe a program or an event or an activity has taken place, a qualitative study could be done to look at the processes, maybe how members of the community embraced or didn't embrace that intervention, how drugs were distributed, things that your quantitative research would not necessarily tell you. Maybe how people felt about getting that intervention, maybe how the people giving the intervention felt about giving it. So it's usually bounded by time, and there's a specific activity. So it's, like I said, very useful for evaluations. So we've looked at narrative inquiry. So we started with talking about the research paradigm, that an example of a paradigm for qualitative research is the constructivists. And that's the idea of the multiple realities, and you're trying to generate theory rather than verify theory. We've looked about different types of study designs. And like I said, it's not exhaustive, but we looked at narrative inquiry, ethnography, phenomenology, grounded theory, case study. And we also try to look at constructing a research question for a qualitative approach, that the kind of verbs you use things like to explore, to describe, rather than say to assess or to evaluate. So it will be things like you're exploring, or you're describing, or you're understanding, and your aim is usually about getting people's meanings or perceptions or experiences of whatever it is. And we'll look at an example as we move towards the end of the lecture. So the next big sort of sub topic is sampling in qualitative research. So because qualitative research is not about generalizability, and not trying to say I spoke to these 2 patients with chronic periodontitis, so therefore I can't say what patients with chronic periodontitis in Ile-Ife, where I am, feel about chronic periodontitis or experience. That's not the point. The point is you have gone in depth, you have really dived deep into that one person or those group of people. So how do you sample in qualitative research? You sample purposefully, and you sample purposefully for information-rich participants. You look for people who, number one, have had the experience and would be willing and able to speak to it. So in this purposeful sampling, there's certain sort of techniques. So you could decide on a homogeneous sampling. You could decide that I'm looking at experience of oral cancer, maybe treatment of oral cancer, and you could decide that you want a homogeneous group, like maybe you want all women, only women who've experienced oral cancer, or only people in a particular ethnic group, or only people of a certain demographic, maybe educational status or socioeconomic status. So you are looking for a homogeneous population. So of course that depends on your research question, it depends on your aim. Or it could be a typical case sampling. And the best way I think of the typical case sampling goes back to physiology. When I was learning physiology, a lot of times we'll learn that the reference values, maybe for full blood count or for blood pressure, was taken from the physiologic male, who is an adult male that weighs 70 kg. So this is the idea of a typical case. You are looking at that phenomenon of interest. You're looking at that, your research question, and you're trying to think, who does this typically affect? So if I wanted to speak to mothers about their experience with early childhood caries, and I'm thinking it would typically affect, so in a place like Nigeria, it would typically affect a woman, maybe a professional woman who lives in an urban area. So that would direct my sampling. Those are the kind of people that I would seek after, because I've not just maybe by literature, maybe backed by my observations, maybe from previous studies, this I can say that this is a typical case. So I would sample, I would purposefully sample for those typical cases. But another technique is the maximum variation sampling. And that's the idea that you want people along a wide spectrum. So maybe an age spectrum. So going back to the example of mothers of children with early childhood caries, I could say I'm interested in teenage mothers, like mothers in like maybe in their 20s to 30s, and maybe older mothers. So maybe I want that spectrum. Maybe for some reason I want to see how age influences their experiences, their perceptions, the meanings they ascribe to it, and I want that variation. So I'll purposefully recruit people along this spectrum to reflect that entire spectrum, or as much of the spectrum of that demographic characteristic that I deemed important, or that the evidence deemed important for that question. Then a last one that I would talk about is the extreme case. So this is like a contrast. So this is not necessarily, is not directly applicable to oral health, but it's the one that comes to mind. So if I wanted to look at meanings, experiences of condom usage, and I decided, okay, I would speak to commercial sex workers, but then I would also speak to maybe people in a convent, for instance. So this would be sort of extreme case. Or if I wanted to speak to people about dental caries, and I said, okay, I would speak to people who take a lot of high refined sugars, and then people who are absolutely like it's all organic, absolutely no preservatives, nothing artificial in their diet. So that would be extreme case. So depending on my research question, depending on my justification, these are some of the approaches that could define how I purposefully sample. In all of these cases, I'm purposefully sampling. It's not a probability sampling, it's a purposeful sampling, but I could, like I said, it could be homogeneous, it could be typical case, it could be maximum variation, it could be extreme case sampling, depending on the research question and the justification I had to take that approach. And so sample sizes for qualitative research are generally much smaller. Sample sizes for qualitative research are generally much smaller than for quantitative. So it's smaller sizes. But what's that exact number? So depending on the range of perspectives you are after. So if I wanted a homogeneous sample versus if I wanted like a maximum variation sample, I would probably need more people in my maximum variation sample. So and then people would say, okay, when your data is saturated, but then there's also a lot of controversy in about that in the literature. But generally speaking, for a focus group, it'll be 6 to 8 people in one focus group, and that would be one homogeneous group. So if you wanted several homogeneous, like different focus groups on the same topic, it will be 6 to 8 people per group. If it was in-depth interviews, most people would say that if you speak, so it can be very wide, between 10 to 30 people. So it's not structured the way quantitative research is structured. So a lot of it is about reading past literature, looking at the numbers that have been used, then looking at your research question, looking at maybe the various demographic groups, for instance, that you want to explore, or the various participant groups. So maybe I want to speak with patients, but then I also want to speak with healthcare professionals, and then maybe I want to speak with other community stakeholders. So all of that will come together to determine my sample size. But generally speaking, it would still be small compared to if that question had been framed as a quantitative research question. Okay, so we've looked at research paradigms. We've looked at the elements of a qualitative research question. We've looked at study designs in qualitative research, and then we've also touched on sampling in qualitative research, how to go about it, how it's different from quantitative research. So what are the data collection methods in qualitative research? So this is generally what people think about when they talk about qualitative studies. This is what they immediately think about. But these are not designs, they're the methods to collect data. So it could be in-depth interviews or one-on-one interviews, observations, focus group discussions, record keeping, or case studies. So like or it could be photos taking. So the photo voice is another data collection method. So different ways of observing, or you could ask people to draw. You could ask people to write their life stories. You could look at their diaries. You could look back into maybe newspaper publication. So these are different ways of collecting data in qualitative research. So maybe just to talk about interviews and focus group very quickly, because they're maybe the two most popular, but like I said, there are several other. So interviews in a qualitative research would usually be semi-structured or unstructured. And again, you're exploring views, you're exploring experiences, beliefs, motivations. So these are the kinds of things that you are seeking, that you're asking about. So the choice of maybe doing an interview versus a focus group discussion, for instance, may be due to the sensitivity of the topic. So there's some topics that people would open up to you more if it's a one-on-one setting than if they were in a group. So that may determine the choice of data collection. So if it's a sensitive topic that you may choose to go for an interview, or if your participants are maybe managers or administrators, you are more likely to get them for a one-on-one interview than trying to bring in maybe like CMDs of hospitals, chief medical directors of hospitals, to a focus group. So those are some of the things that determine the choice of the data collection method. So I have 20 to 60 minutes here. So very generally, the participant should be comfortable. As much as possible, the researcher should have neutral body language. So the interview, it could take many forms, like it could be with technology, so by phone, it could be face-to-face, it could be like via Teams or Zoom. So it really could take a variety of forms, but the important thing is the participant is comfortable, they're in their comfort zone, so that they're able to speak to that without feeling like a need maybe to impress or a need to answer a certain way. Focus groups are another very popular data collection method in qualitative research. And I guess what I would want to emphasize about focus groups is the idea of the homogeneity. The groups should be homogeneous. There should be no power or cultural imbalances. So if I'm trying to find out about maybe oral hygiene cultural practices of children in a community, I wouldn't put mothers with their children, because mothers will have their own very decided views on these things, and the children may differ to the mother. So have the children separate, have the mother separate. So think about power dynamics. If you are doing something with healthcare professionals and you have specialists, you have trainees, you have students, have them in different groups. Otherwise, some people will dominate and you will not hear their views, you will not hear their voice. And usually what informs the choice of a focus group is the idea of wanting to know a group norm. So most of us, or at least I know it's true for me, I'm different. So for instance, in my role as a dentist, I'm probably different as an individual dentist than as a dentist in a group. So my actions, my practices as an individual dentist or individual mother or student or patient may differ from when I'm in a group setting. So the focus groups are usually good for detecting like group norms. What is the cultural norm or sociocultural norm versus individual perceptions and beliefs. So those are some of the things that are going to play in deciding which approach to use for data collection. And in starting off so there will be a facilitator, a note taker, recording devices, and the discussion can be set off in creative ways. It could be a little story, it could be a playlet, it could just be a question that people talk about, or showing them photos, or even asking them to draw and talk about what they've drawn. So yeah, so there are different ways to get people, but the important thing is everybody is talking and everybody's voice is heard. So they need to be small and they need to be homogeneous. So we've run very quickly through several things: research paradigms, a research question in oral health research, sampling, study designs in oral health research, data collection method, and now we're going to data analysis. So very brief, high-level overview. How do we analyze data in qualitative research. So it's a focus on text rather than numbers. That's why it's qualitative rather than quantity. So it's not about the quantities, it's not about the percentages, or it's about the themes, it's about the themes really that are coming, that the researcher is able to read, maybe from the transcripts or from the audio of the data. And analysis occurs with data collection. So that means your questions may change as you are listening to responses. So it's not inflexible, it's not structured, it responds to the participants. And then it's so important to document the processes that are going on. So if there's an interview and you ask a question and the person stiffens or goes silent for a long time or has some facial expression, it's important to document all of the non-verbal things that are going on, not just the verbal. And then once you have all of these, maybe organized into transcripts, you read them for a general sense. And of course, according to your research objectives, you start to organize into concepts, into codes, and into themes, and you start to look for connections. So it's a really personal journey. It's something that the researcher, like you are steeped in the data, you are immersed in the data, and the themes that you derive from the data are also a reflection of your training, your background, your perceptions. So I could read the same data and come up with different themes because I'm different. So that's why in qualitative research, it's also very important for the researcher to be upfront about their own biases or about their own preconceptions about their findings. So there's something called researcher reflexivity. So talking about who you are and how those things may or may not influence your reading, your analysis theory. I touched upon that lightly when we were looking at the study designs. There's content analysis, narrative analysis, discourse analysis. Again, so thematic analysis. Again, this is not an exhaustive list, and these are specific approaches that one would need to go and read specifically about to get, sort of the technique. But in generality, all of them are focused on text rather than numbers, and all of them are about the researcher being the sort of the instrument you're reading, and those things are making sense to you because of your own lens that you are bringing, your own cultural or educational background that you're bringing into the study. So the tools, just like we have tools for statistical analysis, there are many tools also for qualitative data analysis. But the primary one is the manual. That's the researcher, because whatever tool you use, it's still you reading and coming up. With the advent of AI, maybe AI can do some of that, but it's still you, the researcher, taking responsibility for the reading and the themes and the concepts and the codes. So these are just a list of the maybe more commonly available tools, but then not an exhaustive list. There are many, but these are some of the commoner ones that people use. Okay, so
Dr.
Okay, yes,
Lola,
please.
I'm so sorry for the late reminder, but we are past the 30-minute mark.
Thank you. Okay, I'm almost at the end. Thank you for the reminder.
No worries. Take your time.
Okay, so we've looked through paradigms, the research questions, sampling, study designs, data collection methods, data analysis technique, very high level overview, not in depth, given the time that we have. And this last bit of the presentation is maybe to speak to a particular topic or research question and look together at how it may evolve and then maybe speak to that. So this question, so I'm assuming that I was working on the perceptions and experiences of early childhood caries among mothers. So these are some of the things I could say, okay, a sample of 24, and I'll give a justification for that 24 in a bit. A case study, maybe a program and an intervention has taken place for early childhood caries, and I want to look at how these mothers took up that intervention or not. And I could decide on an in-depth interview. It could be a focus group, but I could decide on an in-depth interview with the mothers and decide to purposefully select these mothers to represent the variations of practice and child's carie status. So, and that's how I came up with the 24, which I'll show you in a bit. So maybe there's an intervention, something has gone on before, or I've had a way of assessing mothers' practices concerning caries as good or poor. But then there's some mothers that even though their practices are good, their children have early childhood caries. And there's some mothers that even though their caries prevention practices by some definition that I've defined are poor, their children don't have early childhood caries. So I could do a case study of this and say 6 mothers in each of these groups. So good and but has early childhood caries. Good, no early childhood caries. Poor, has early childhood caries. Poor, no early childhood, and then do an in-depth discussion with them. Or it could be focus groups. So I could have 4 different focus groups with these sets of mothers. So you notice I have similar mothers, like at least homogeneous as per their practice and their child's carie status. There are other things to consider about homogeneity, like language, like educational status, because you don't want anybody feeling like, oh, I can't speak when these people, they know more than me. You want everybody to feel equal. So, but this is just like a very rough approach that I hope has been able to maybe give more solidity to the things that we've been talking about. And I think that's probably my last slide. Yeah, so that will be my last slide. And I'm right at the 45-minute mark and open to questions. So I have this thing, clearest point, muddiest point. It's something I learned that I like if people are willing, maybe type in the chat and say this was very clear from the presentation. So that's good. That makes me happy. But then there'll be some things that, oh, I've been here for the entire 45 minutes and this still remains absolutely unclear. So yes, so thank you very much for your time. Thank you for your attention. So I'm open to your questions and comments at this time. I can't see the chat though, so I may need your help. If anything has come in the chat, for some reason, I can't see my chat.
No, it's totally fine. Thanks a lot, Dr. Lola, for this very informative session. We have one question here written by Dr. Goodwin. It says, the lecture is very insightful. Question. I know that we are talking about qualitative research today, and you have pointed out that such study design employs purposeful sampling. But please, is quantitative research anchored on probabilistic in terms of sampling, or could it also be anchored on purpose sampling? That's the first question.
Okay. Yeah, so thank you. That's an important question. So generally speaking, because quantitative research is about being able to generalize to the wider population. So generally speaking, you want to do a probability sampling so that you can generalize your findings to to your population of interest. But it's not feasible in every case. Like if you are doing quantitative research in a conflict zone or about a disease condition that is associated with stigma. So there's some instances where you can justify why you are using a non-probability sampling technique in quantitative research. But generally, your first choice should be a probability technique. But where you have a reason why that is not feasible, then you just explain why and then state which probability sampling. But I think the take home is for qualitative, it's always purposeful. It's qualitative is never about trying to do a probability sampling that is representative of the entire. It's never about that. It's always purposeful. Quantitative should be, ideally, should be probability sampling, but sometimes that's not possible, in which case you would be justified in using a non-probability sampling technique. So I hope that answered that question.
All right, we have a second question. This same Dr. Godwin said, please, Ma, what's the difference between FGD and an in-depth interview?
Sorry?
He's asking, what's the difference between FGD and an in-depth interview?
Oh, right. Oh, so in-depth interviews are usually one-on-one, researcher and participant. So usually one-on-one. FGDs are groups, so a group of people. So like I said, 6 to 8, some people will say 6 to 12 people. So you're speaking to a group of people. So interviews are usually one-on-one. So it could be because the topic is sensitive, or it could be because the participants don't have the time, like you can't bring them together in a group, or it could be that the groups, the people that you're talking to, they're not forming a homogeneous group. So it would be counterproductive to put them together in a group. So, but interviews, one-on-one, usually sensitive topics, and it's researcher and like the researcher and the participant talking. Unlike the focus group where it's a group of participants, so 6 to 8 people, some people will say 6 to 10, 10 or 12. So they're the ones talking, and then the researcher is taking notes. The researcher is there as a facilitator of the discussion. So let's say you are interested in maybe tooth oral hygiene practices among adolescents. So you want them to talk, like you want to hear what they feel about maintaining their oral hygiene, what they use, where they get their information from, what times of the day. You want to hear them, but you are there as a facilitator, allowing them to speak and then taking notes and recording them. So it's a group of homogeneous people talking about that topic or condition that you've brought them together for. So I hope that's clarified that.
All right, we have, I think someone is raising their hand. Give me 1 minute. All right, doctor, I think you can unmute your mic now.
Good evening, Prof. Thanks very much for your wonderful presentation. It has been very insightful. My name is Immaculata Eko, Obafemi Awolowo University. Please, my question is, if you're conducting a study in different departments among students, and you want to form a focus group among those students. You have from levels 100 to 400, and in sometimes some cases 500. So if you're forming a focus group among them, it said right to select level 100 from the department you've selected, or each department is each department, all the levels, you can form a focus group among them.
Okay, thank you very much for your question. So that would really depend on the research question. If it's something that, let me give an example. If I wanted to find out about oral hygiene practices among students, what they use to brush their teeth, and among university students, and I had dental students and maybe students in music, so I wouldn't put dental students and music students together, just because I feel that the dental students will have more knowledge. So, and I wouldn't want the music students to feel as if we can't talk, because these people, they would know they're dental students. These people know about this topic. But if the research question was maybe about the government of the day, something like that, like maybe how do you feel about the university administration or the government of the day? So if it's something that I feel that it doesn't matter, your discipline doesn't give you an advantage, then in that case, it may not matter. Maybe it may be other things that will matter in that sense. It may be gender that would matter. So it really depends on the very specific context and your research question, and whether you feel. So sometimes it's okay to have men and women in the same focus group. Sometimes it's okay because the topic, it wouldn't matter. But then sometimes it would not be okay because it would matter. Maybe women would keep quiet because the men are there. So it really depends. Sometimes it would be okay to put people of all ages together, like it wouldn't matter, they would all speak. But sometimes it would matter. So it really depends on what you are studying and what you are trying to get, what your research objective and your research question is. And then you think, okay, what characteristics would give maybe certain people an advantage, will make them maybe seem to have some power or more knowledge than this. So you wouldn't want to mix them up in that situation. I hope that helped.
Yes, thank you very much for your response.
You're welcome. Thank you.
All right, we seem to have a lot of questions now. Someone was saying, will we get the recording? Yes, the session is recorded and it will be published on the LinkedIn page, also on our website soon. So just please follow and it will be published soon. Dr. Adeto Miwa, I'm so sorry if I'm reading the name wrong, is saying the methodology and the data collection methods were clearly explained. I would have loved to learn more about the data analysis, especially thematic analysis. Thank you for the excellent presentation, ma'am. We have another comment saying, please, Ma, I will be needing the slide presentation. Thank you. If it's possible, you can share with me and I can share with them later.
Sure.
And okay, some question. Must you have some notes as talking points so as to guide the discussion in an FGD, or do you allow the group to decide what to discuss?
Oh, remember you're the researcher, you brought them together, so you have a purpose for bringing them together. So you definitely want to guide, like you want to stay within your research purpose. Otherwise, they could just become like friends, just going off topic. So you definitely want to guide. So yes, so that's why you need like to have some questions, and not just questions, to also direct the conversation. So like to say things like, okay, thank you. So bringing us back, what do you think about this specifically? So you don't, it's not, that's why you somebody has to be there as a facilitator. So it's not a free discussion time. No, it's a guided discussion time, but you are doing the guiding from the background so that it's not your opinions or your views that are getting into the discussion. You are giving them a chance to speak, but yes, you are certainly, so you need some notes, like you need to prepare. It's really, it takes a lot of skill and it takes a lot of practice to be a good facilitator at a focus group discussion. Otherwise, it just ends up being times that people catch up on, like, oh, they're seeing each other and then they're all getting to know each other and catching up. So it's a very skilled, it takes skill and practice to learn that, so that you stay within topic and you don't lose focus of the purpose for which you have brought them together.
All right, we have one last question, I guess, from Dr. Latifa. She says, "Thank you for the great presentation. Is it possible to transform qualitative data into quantitative data by attributing numerical scores?"
Oh, definitely. It's also possible to do the reverse. Like some people will talk about qualitizing quantitative data, but that's way beyond the scope of this lecture. Like we barely could dive into qualitative research itself. But the short answer is yes, it is possible.
All right, and I think we have just one last comment from Dr. Kikolomo. He says, "Well done and thank you. Clearest points was data collection method. What was not so clear was the data analysis methods and tools." If you have any comments on this, Doctor?
Oh yeah, so yeah, thank you for that comment. Yes, I realized that many things were rushed through, and yes, so the data analysis, it's a huge topic on its own, and using the tools, like there are several tools, and learning to use any tool itself, it needs several hours of engagement. But I'm just hopeful that the little that this has maybe given a seed, maybe for us to develop better. But yeah, so thank you for that. Maybe if I ever get such an opportunity, maybe I would consider devoting a little more time to that section. But thank you for that comment.
Thanks a lot, Dr. Yoga, for this session. I think we don't have any more questions. Yes, no more
Yeah, thank
questions in
you.
the chat. No one is raising their hand, so all is good. Thank you so much for today. And thanks everyone for attending as well. Have a great evening.
Thank you. Okay, bye-bye. Thank you very much.
Thanks a lot. All right, everyone, please just remember to fill in the form, feedback form. I sent it on the chat. We would really appreciate your opinion.